Hello, my name is Brian, and my classmates is Nadine and Lorena. So we're going to talk about sickle cell anemia. And first, we're going to give a little definition about what it is. So this is a genetic blood disorder characterized by the production of abnormal hemoglobin, known as hemoglobin S. So we have this case, and this case we're going to talk about Juan Perez, male, 15 years old, and the reason for consultation is severe chest pain and difficulty breathing. And we have to know the background, where we have a personal history, where the patient with a no diagnosis of sickle cell anemia confirmed through neonatal screening, a history of multiple painful crises, usually triggered by infection and dehydration, and also some family history. Both parents are carriers of the sickle cell trait. Some symptoms and signs. It's the sharp chest pain from the past 12 hours, difficulty breathing and coughing, extreme fatigue, visible jaundice. The temperature it's 38.5 degrees Celsius. The heart rate is 120 beats per minute. The blood pressure it's 100/65 millimeters from mercury, and also the oxygen its saturation it's 90% on room air.
Physical examination, observation tends on patient of the chest, clearing units, and moderate splenomegaly, pale skin, and muscle membranes. Laboratory test, complete blood country, hemoglobin, and 6.8 gram deciliter, hematocrit 20%, nuclei count elevated, white blood cells, and 18,000 cubic millimeters, and hemoglobin electrophoresis predominance of hemoglobin, and biometric total bilirubin 5.2 milligrams deciliter, LD8 and 715. Diagnosis and acute chest syndrome in the context of sickle-cell anemia. In case discussion, Juan Perez, an adolescent with a no diagnosis of sickle-cell anemia, present with acute episode of chest pain and difficulty breathing consistent with acute chest syndrome. And this severe complication is characterized by the presence of new pulmonary filters visible on chest X-ray along with respiration symptoms. Pathology discussion and definition. Accounts and sickle cell anemia is a genetic disorder that causes the production of abnormal hemoglobin in low oxygen condition. Hemoglobin polymerization, deforming red blood cells and causing vascular obstruction. Acute chest syndrome is a severe complication that occurs when sickle shaped red blood cell block blood vessels in the lung, causing inflammation and tissue damage.
Now, the association of symptoms with the case. First is chest pain caused by a blockage of blood vessels in the lungs and resulting inflammation. The next is difficult breathing and coughing. This is result from lung involves and the presence of pulmonary infiltrates. And the extreme fatigue is due to severe anemia and reduced oxygen carrying capacity. The next is jaundice, and this is resulting from chronic hemolysis and it relates to of bilirubin from destroyed red blood cells and the perlanins. This is associated with chronic anemia and low hemoglobin levels. And the diagnosis of acute chest syndrome is made by chest X-ray showing new pulmonary infiltrates and clinical evaluation of respiratory symptoms and chest pain. Now, for the treatment management, the treatment of acute chest syndrome is oxygen therapy to maintain adequate oxygen saturation. The intravenous hydration is to prevent dehydration and improve blood flow. The antibiotics is to treat possible concomitant lung infection. The pain relievers is to manage pain, and the blood transfusion is to improve anemia and reduce the number of circulating sickle cells. And the long-term management of sickle cell anemia is hydroxyurea to increase the production of fetal hemoglobin or HbF and reduce the frequency of crises. The vaccines and prophylactics antibiotics is to prevent infections, and the patient education is importance of hydration, avoiding stress and infection, and early recognition of crisis symptoms. And the current research of future diagnosis is gene therapy, ongoing research on correcting the underlying genetic mutations, and new medication for the develop of drugs to improve HbF production and reduce the adhesion of sickle cells. And finally, the conclusion is Juan Perez's case illustrates a severe complication of sickle cell anemia, acute chest syndrome, and this case highlights the importance of early diagnosis and appropriate management to prevent severe complications. And current research in gene therapy and new treatments offers hope for a future with better therapeutic options and potential cures for the debilitating diseases. And this was our clinical case. Thanks for the attention.